and welcome to the SLTV. This video was created from an article on our health website. I'll drop the link to the article in the description box. After watching, please make sure you like, share, and subscribe. See you
Hello and
soon.
welcome. Today, we're going to talk about something that affects millions of people, but is so often misunderstood. We're diving into endometriosis. Our goal here is to really shed some light on this condition, break down what's actually going on in the body, and look at the different paths to managing it. You know, this quote really just says it all. If you've ever had pain that completely knocks you off your feet and disrupts your whole life, I want you to hear this loud and clear. Your pain is real, it's valid, and you are definitely not alone. This is way, way more than just bad cramps.
And just how not alone are you? Well, the numbers are pretty staggering. Endometriosis affects 1 out of every 10 women of reproductive age all around the world. So think about that. This isn't some rare, obscure disease. It's a major global health issue.
But here's the part that's truly hard to wrap your head around. The journey to just get a name for this pain takes, on average, almost 7 years. Can you imagine that? 7 years of dealing with symptoms, of not knowing what's wrong, and that is exactly why we need to be having this conversation.
So, here's our plan for this explainer. We're going to talk about what endometriosis actually is, how you can listen to your body and recognize the signs, what the path to a diagnosis looks like, all the different treatment options, and finally, what it looks like to live well with the condition. All right, let's get into it.
So first up, what is endometriosis really? I mean, to figure out how to manage something, we first have to understand what's going on. What's at the root of all the pain?
Okay, so in the simplest terms I can put it, endometriosis is when tissue that's supposed to be on the inside of your uterus decides to grow on the outside. This tissue, it acts just like the uterine lining, but it shows up in places it has no business being, like on your ovaries or fallopian tubes, or basically anywhere else in the pelvis.
So you might be wondering, why is that such a big deal? Well, because that misplaced tissue still gets the memo every month to act like it's in the uterus. It thickens and bleeds with your cycle, but here's the problem. That blood has nowhere to escape. And this kicks off a whole chain reaction. It causes a ton of inflammation, which then leads to scar tissue. Sometimes it even forms these painful cysts on the ovaries. And over time, all of that constant irritation can make your nerves super sensitive, which is what leads to that chronic, relentless pain.
So, what does all that biological chaos actually feel like? This next part is all about learning to recognize the signs, tuning in and listening when your body is trying to tell you that something is off.
Now, everyone's experience is different, but there are some really common signs that tend to pop up. We're talking about pelvic pain that's so bad it makes you cancel plans. Pain during or after sex is a big one. Also, really painful bowel movements or urination, especially around your period. And it doesn't stop there. Things like bloating, fertility struggles, feeling exhausted all the time, and a killer lower backache during your period can all be major clues.
And this next point is so important to understand. The severity of your pain has almost nothing to do with how much endometriosis you have. You could have just a tiny bit of tissue and be in absolute agony, while someone else could have a lot and have fewer symptoms. So please, hear this. Your pain is real. It's valid, no matter what a scan might show.
Okay, so let's say these symptoms are sounding a little too familiar. What happens next? Let's walk through what it actually takes to get a diagnosis. Just knowing what to expect can make the whole process feel a lot less scary. Usually, it all starts with you telling your story, every detail of what you've been experiencing. Then, a doctor will probably do a physical exam and might suggest some imaging, like an ultrasound or an MRI. For a really long time, the only way to be 100% sure was with a minimally invasive surgery called a laparoscopy, where they can actually see the lesions.
But, and this is a big but, the way we diagnose this has been changing. While surgery is still the gold standard for a definitive diagnosis, it's not always the first or even necessary step anymore. Often, doctors can make a pretty confident diagnosis and start a treatment plan based just on your symptoms, your exam, and what they see on an ultrasound.
And that leads us to the most hopeful part of all this, finding a treatment plan that works for you. Now, there isn't a magic cure for endometriosis yet, but there are so many effective ways to manage the symptoms and get your quality of life back. The single most important thing to know is that there is no cookie-cutter approach. Your treatment plan is going to be completely unique to you. Think of it like a custom recipe based on your specific symptoms, how severe they are, your age, and really importantly, what your goals are for the future, especially when it comes to having children.
So generally, the options fall into about 4 main buckets. You've got pain medication, like NSAIDs, to tackle the inflammation. Then there's hormone therapy, which is all about slowing down or stopping your periods to give that tissue a chance to quiet down. Surgery is an option to actually go in and remove the lesions. And of course, for those who want to get pregnant, fertility support is another huge piece of the puzzle.
Now, when we talk about surgery, there are 2 main paths. The first is what's called conservative surgery. The whole goal there is to remove the endometriosis itself while leaving your uterus and ovaries intact. The other path is a hysterectomy. This is obviously a much bigger deal, and it's usually considered a last resort for really severe cases, after other treatments haven't worked, and when a person is done having children.
Because endometriosis is a chronic condition, treatment is just one piece of a much bigger picture. The final step is really about learning how to live with it day to day and finding strategies that support your well-being for the long haul.
Building a solid support system is absolutely essential, and I don't just mean your gynecologist. Think of it like assembling your own personal health team. This could include a pelvic floor physical therapist, a mental health counselor to help with the emotional side of chronic pain, and even support groups with other people who just get it. You don't have to go through this alone. And there are so many things you can do yourself to feel more in control. Keeping a diary of your symptoms can reveal patterns you never notice otherwise. Learning how to talk about your needs at work or school is a huge skill. And exploring things like gentle exercise or stress management with your doctor can make a world of difference. It's all about being an active player in your own health journey.
Look, understanding what's going on is always the first, most powerful step. But the next one, well, that one's up to you. So, the only question I have left is the one you see right here. Are you ready to take everything you've learned and become the best possible advocate for your own health?
Please subscribe.